Psychological therapies for the treatment of schizophrenia. Cognitive behavioral therapy. So CBT, the aim of CBT in general involves helping patients identify their irrational thoughts and trying to change them. This can involve a vigorous argument or a discussion of how likely the patient's beliefs are true and considering less threatening possibilities. During CBT, the therapies will change the patient's interpretation of events, which is empirical argument, and this will help to change their pathological thinking. Patients learn to consider alternative ways in explaining why they feel and behave the way that they do. CBT helps patients to think more positively and to cope with their symptoms. They are set behaviour assignments to help improve their general level of functioning. Research to support CBT comes from the NICE review of treatments for schizophrenia. It found consistent evidence that when compared to standard care for antipsychotic medication alone, CBT was effective in reducing relapse rates up to 18 months following the end of the treatment. In comparison to standard care, CBT was shown to effectively reduce symptom severity and improve the patient's overall social functioning. This shows that CBT is an effective treatment, better than antipsychotic drugs which have major side effects. CBT doesn't change the person's brain neurochemistry, which further increases its support to help schizophrenic patients. However, a methodological criticism of these studies is the effectiveness of CBT has been conducted with the patients treated at the same time with the antipsychotic medication. It is therefore difficult to assess the effectiveness of CBT independent of antipsychotic medication. It may be better to have used an independent group design to reduce order effects. This would increase the validity of the study and its support. This would reduce the validity of the study and its support for the use of CBT as a more effective treatment for schizophrenia.